Hello, everyone, and welcome to this webinar that will focus on the consequences of further marketization of elder care in Iceland and the Nordic and Swedish experience of going down that path. My name is Þórður Snær Júlíusson. I'm the editor-in-chief of Hverjar and will be your moderator here today. For those that need Icelandic interpretation, you can press the globe at the bottom of the screen. Our keynote speaker here today is Marta Szebehely. She is a professor emeritus in social work at the University of Stockholm and has won numerous prizes for her research in the field of policy and elder care. The most recent one earlier this month, the prestigious Solberg Prize at the 25th Nordic Congress of Gerontology here in Reykjavik. She's been studying how various policy and organizational changes have affected the daily life for care workers as well as for users of care and their families in Sweden and other countries for almost 4 decades. And she's been analyzing the consequences of marketization and privatization in Swedish elder care since the early 1990s. In her lecture today, she will give us a deeper understanding of how considerable parts of the elder care in Sweden was marketized and how the shift affected the care sector. What happened to costs, quality of care, and working conditions in care work? And what are the consequences for universalism? Has marketization led to increased inequalities and access to high quality care? The setup here today will be quite simple. First, our keynote speaker will hold a half-an-hour lecture that will be followed by a half-an-hour discussion between her and Sonja Ýr Þorbergsdóttir, the chairman of the Federation of State and Municipal Employees, and Drífa Snædal, the president of the Icelandic Confederation of Labor. These discussions will be moderated by me. There will be room for questions from our servers during the discussions. Anyways, we have a limited time frame here today, so without further ado, I welcome Marta Szebehely to start her lecture.
Oh, thank you very much. Thanks for the invitation and for giving me this opportunity to speak about an issue that I've been very, very interested in and also quite worried about for quite a long time. But I just try to share my screen immediately and start sharing. It should work. Okay. I hope it works. I can see my slides and you can see them too. So the title I gave to my presentation is the 3 decades of marketization in Swedish elder care, trends, actors, and consequences. So, but I want to step back just one little step and start to say a few words about universalism, because that is an ideal in Nordic elder care in all the Nordic countries. And when people outside the Nordic talk about what is typical for Nordic elder care, they usually stress that it's mainly publicly funded, generously publicly funded. It's also publicly provided. So it's not only publicly funded, but also provided by municipalities or other local public organizations. And it's also high quality services that are directed to and also used by all social groups according to need and not the size of the wallet, not according to purchasing power. And this is an equality ambition. And it was very clearly said in the Swedish context, in the idea about the people's home, that only the best is good enough for the people. And the idea is that if both rich and poor are using the same services, it will be better services for poor people, because if you have only services that are for poor people, then they will actually be quite poor services. So the idea is that only the local state can provide guarantee that you have good enough services or really good services for all social groups. So if you look at what happened since, this is how it was formulated in the 40s and 50s, services in the Nordic countries are still mainly publicly provided, but we have seen trends of marketization since the early 1990s. And we have gone from 0 for-profit private elder care before 1990. There were virtually no private elder care, for-profit care in any of the Nordic countries before 1990. And today, about 1/5 or 20% of elder care services are run by for-profit providers in Finland and Sweden, but less than 5% in Denmark and Norway. So there are some differences between the Nordic countries. In the Nordic countries and also the rest of the world has a very different size of the non-profit sector. The ideal organizations that are private but not for profit. But what we haven't seen anywhere is since the early 1990s is an increase of the non-profit sector. It's a for-profit sector that has grown everywhere. So if this graph shows the mix of public, private non-profit, and private for-profit in different countries, and it's only shows the share in residential care, in nursing homes. There is much less statistics on home care. But we can see the 4 bigger Nordic countries to the left. We can see that Finland has almost 25% for profit in the residential care sector. Sweden has around 20, and I said 5 in Norway and a little bit less in Denmark. And then the different size of the non-profit sector. But the majority is public in all the Nordic countries. And we can see differences in different countries. But I would like to stress the United Kingdom, England and the other countries in the UK, because they were very similar to the Nordic countries in the early 1980s. The majority of services in England were public. And now, as you can see, 80% of residential care are run by for-profit companies. So things can change quite rapidly once they start to change. I think that is important to realize. So we can see that there were some differences between the Nordic countries, except for Iceland. I have no statistics on Iceland. I apologize for that, but you know Iceland, and I'm sure you can come back to the Icelandic situation in the discussion. But there are also similarities in the Nordic countries. I hope to come back in the end to some other differences. But what is similar is that profit-making in elder care is allowed in all the Nordic countries, while profit-making in schools is only allowed in Sweden. Another similarity is there is very little good statistics on this issue. And usually in the statistics, they don't distinguish between non-profit and for-profit, which is, I think, a problem, because we are not used to think about that distinction. We used to think about public and private, but not the distinction between for-profit and non-profit. But it's also important to notice that profit in welfare service is a highly contested issue. But also important, where we do have studies of this, where we have in Sweden, is that the majority of the population is actually against profit-making companies in the welfare sector, in elder care, in disability services, in school, in healthcare. So 2/3 of the population in Sweden are against profit-making in this sector. But there is a gap between politicians and the general population. So I want to share with you a graph from a report, and I'm happy to share my slides to anyone, and there is a link to this report in the end of my presentation. It's actually a very interesting and important report, I would say. So what it shows, this one, at the top of the graph, the question is, profit distribution shall not be allowed in tax-funded healthcare, education, and social care. So that is the statement, and whether people agree to that statement or are against that statement. So we can see that among the voters at the bottom of this graph, on the left and green parties, the vast majority are positive to such. They don't want to have profit making in the welfare services. But we can also see that among the Liberal and Conservative Party voters, actually a large proportion are also don't want to have profit making in welfare services. But then if you look at the politicians, the elected at the top of the same graph, we can see that for the left and green parties, the voters and the politicians are quite similar in their opinion on welfare services. But if you look at the Liberal and Conservative parties, the politicians are really to the right from their electorate. You can see that none of the center, Liberal and Christ Democrat parties think that one should stop profit making in welfare services, while around half of their voters actually are for that. So that this is also an important thing, and that is why these things are not changing in Sweden, despite the general public is against profit making in the welfare services, the politicians are not to the same extent following their voters. So one more point that I would like to stress is that are similar in the Nordic countries is that there is really big local variation. So in Sweden, half of the municipalities, we don't have any private elder care at all, but there are around 20 municipalities out of the 290 where the majority of even all elder care is private. So we have very big differences, and here political majority matters, but also urbanization and size, because the private actors are more interested to establish themselves in highly densely populated areas, with particularly if there are rich people, and I will come back to that. So we have seen in Sweden a shift from public to private providers in 3 waves since the early 1990s. And the first wave was that I call it competitive tendering and outsourcing. I will come back to each of these 3 waves, and it was mainly in residential care. The second wave was when customer choice models were introduced, and there was mainly in home care, but increasingly now also in residential care. And the third wave, which is not really about, which is kind of outside the elder care sector, but it's a tax rebate where you can buy services, care services or household services for half the price, and because you get 50% back from tax. So I will talk a little bit about each of the 3 waves. So the first wave of marketization, the outsourcing of the competitive tendering, the promise or the kind of idea behind it was that if private providers can compete and offers to run services, it will improve the quality, it will reduce the cost. And small companies and non-profit organizations will stimulate the public sector. And this idea came from the UK and the US, under particularly to Sweden, it came from Thatcher's England. And we changed the Local Government Act in 1991. It was still under a social democratic parliament, or government, sorry. And that act made it possible for municipalities to outsource all kinds of care services and also schools. They were not forced to do it, but they were allowed to do it because of this change in the Local Government Act. And the hopes was that it would stimulate the public sector. That was the main argument for the Social Democrats at the time. So in practice, it works like the way that municipalities have a nursing home, and they invite private actors to compete to run this home for 6 or 8 years. And initially, it was almost entirely about price competition. The company that promised to run the home for the lowest cost won the competition. And there was very little quality competition at the time. It has changed later, so it's more stressing quality aspects today. But this favored the large corporations. So already in the early 1990s, the large corporations got a foothold in Sweden because they could give a low bid. They actually sometimes underbid. They gave a bid that wasn't financially good for them, but they got a foothold and ran a nursing home. And they also had resources to write convincing bids. And this is still the case, because it takes quite a lot of skills and time and people to write a bid. It's a lot of information that has to be given. So even now, the large corporations actually do win the competition, and non-profit organizations have difficulties winning, even if they actually can provide really good care. They don't necessarily can promise to do it in the kind of documents that is demanded. So because of this, large companies got a foothold very early on, we have today a very highly concentrated market in residential care. So we have some very big actors that are active not only in elder care, but also in disability services, in social psychiatric units. They also run child welfare homes, and also they have also been quite active in homes for asylum-seeking minors in Sweden. So they follow the money, to put it simple. And the two largest corporations, Attendo and Ambea was known as Carema earlier, they have together more than half of all private residential elder care in Sweden. So they have, the two companies together have 10% of the Swedish residential care sector. And that is actually a very high concentration compared to most other countries. And they are really big. So Attendo has 25,000 employees and Ambea has 26,000 employees. Attendo is very big in Finland. Ambea is mainly big in Sweden, and in Norway they have mainly homes for child welfare. They don't have much elder care in Norway. So, but what is a new phenomenon, and I would like to stress that because it's quite important, is that nowadays these big companies, they don't compete for contracts. They actually build their own homes. They are, so 80% of Attendo's and 71% of Ambea's net sales are what they call own operations. They build new homes and offer places to the municipalities. And this is not so surprising because the Nordic welfare states are aging, but they are also generous. It's a very attractive market. So this is from Attendo's annual report. We can see that half of the Swedish care homes beds that were built or under construction in the last 5-year period, they were built by private providers, for-profit providers, and 80% of the beds in Finland were built by Attendo or other private providers. So this is something that we can see now happening also in the other Nordic countries where they are allowed to build their own homes. In Norway, they are not. But in Denmark, they are starting to build also this type of home because they can be safe that this will be filled with people. And of course, for the municipalities, at the short term, it's a very attractive solution because they don't have to spend money to build a home. But if they want to, at one point, to run the home by themselves, make it a public home, they have to build a new home. And this, we know from the US, is a serious problem in there because they have some really, really bad nursing homes, but they can't close them down because they are very big, like 400 beds, and they don't know where to put people. So this is attractive in the short term, but also quite dangerous route, I would say. So the second wave of marketization was partly as a response to this concentration tendencies with the large corporations being dominating. So it's, and that is the choice model, consumer choice model. The promise or the kind of argument for this model is that the possibility to choose and choose again will empower users. And it will increase quality because once you leave the providers that are not good, the bad providers will not survive, and then the quality will increase. And it was also very strongly stressed in the Swedish legislation that it will facilitate for small companies to enter the business. And therefore, a piece of legislation was introduced in 2009. The choice legislation, which made it much easier for the municipalities to just invite anyone who wanted to run home care. And it is a kind of a free establishment because the municipality must accept all providers that meet reasonable demands, as it was said in the legislation. They cannot limit the number of providers, which led to many small home care companies, but also to some scandals and problems. So in 2019, since 2019, also a home care provider need to have a permit from the National Health and Social Care Inspectorate. Before that, only the nursing homes needed that kind of permit. So it has become a bit more complicated to set up a home care company than it was until between 2009 and 2019. But we have still a fragmented home care market, in particular in Stockholm, where in 2006 we had 56 companies running home care. In 2016 we had 180. So in each area of the city at the time, there were more than 100 companies to choose between if you were being eligible for home care. And now it has gone down to 72 companies, partly because of this demand on permits since 2019, but also because the local municipal politicians decided to have more strict demands on collective agreement to make sure that the workers had better employment conditions than they had. But there are still very many small companies, and it is difficult for companies to survive. So there is often they are actually often being closed down. So it's not so much that the users are exiting the services; it is the company that exit, and therefore it's a forced exit. And it's still a problem. People find it difficult to choose, and it's also difficult for the city, Stockholm City, to control so many providers, and we have had several cases of fraud in home care. The third form of marketization, tax rebate, it's actually totally outside the elder care services, but what is important is it is actually quite often used by the older people. But I think I mention it here because it interacts with the choice models, because the private providers of home care that you are needs assessed, and it's mainly publicly funded, the private providers, they can offer extra services. So you can get an extra cleaning from the same staff and you pay half the price because of this tax rebate. And this is therefore an incentive for high-income older people to choose a private provider, which means that they also run the risk to leave the tax-funded home care to the public home care to poorer people. So this kind of idea that you have both poor and rich people using the same service is at risk. And more importantly, it is possible in these private nursing homes that are still mainly publicly funded, but if they're built by the companies themselves, they can also offer extra services, which might lead to very different system with one set of nursing home for rich people and another set of nursing home for poorer people. So what do we know then about the consequences of marketization? Sorry about speaking fast, but I mean, I wanted to say quite a lot of things in half an hour. So what do we know about was it cost saving? Well, the first generation of outsourcing with price competition, it was actually some cost savings there. But then there were also worries about the problems with quality. So we haven't seen any new studies that it was cost saving in later generation. Actually, for the moment, if municipalities outsource services, they actually set the fixed price and let the providers compete in who can promise to provide the best quality. So cost saving is not really the issue. And we have seen some evidence for higher costs in municipalities with choice models. But I think actually the most important message here is that today in Sweden, there is absolutely no discussion on cost saving. It is not on the agenda at all. But what we do not know, because we don't have the information, we don't know to what extent there are increased costs for increased regulation and oversight because of the a new market that has to be controlled in a different way. So I think we can leave the cost saving aside. So what about quality then? Well, I would say that this is a contested issue, but I would say that we haven't seen any evidence for improved quality. If you look at what care research stresses is important for good care, is that it is enough time in the encounter between the care worker and the care user. It's important to have good continuity so you don't have different people coming and going. And it's important that the care can be flexibly provided, that it's not regulated in detail what the care worker can do at a certain situation. So if you know that time continuity and flexibility is important, we know in Sweden, as in every other country where there is a market, we know that staffing levels are lower in the private sector, in the for-profit sector. We also can notice in Sweden and in most other countries that the training level is lower. So there are less skilled staff in the private companies. And there are also more casual workers. They don't have permanent employment. And this is not surprising because the salaries are the highest expense for the providers in elder care. And of course, if you want to reduce your cost on staff, you can reduce the staffing level, you can employ people with less training, and you can employ them by the hour. And that is the case also in Sweden, which means that there is less time between the care workers and the care users, and less continuity when you have a lot of people employed by the hour. On the other hand, we also collect data on self-reported process quality, and there the for-profit sector is doing much better than the public and the non-profit. So there is, for instance, whether you have risk assessment for risk of falling or malnutrition or things like that. But what we do not know is whether actually you have less risk in practice. We also only know that on paper you do better on this measure. And we have no difference in user satisfaction between public and private, and we have no difference between municipalities with and without choice models. So I would say that we actually have, we don't know, we haven't seen improvement, but we haven't seen really the very bad consequences as they have seen in the US, because it is more regulated in the Nordic countries, I would say. But what we do also have a problem with is that we have seen much more detailed regulation, and particularly in home care, with this kind of minute schemes to showing that you have 5 minutes for doing this and 15 minutes for doing that, and the care has become less flexible, and that is strongly related to the need for controlling the for-profit providers after cases of fraud, which actually has negative consequences for both the good and bad providers. So should we really expect that choice models would improve quality? Well, according to economic theory, choice can increase quality if it is easy to assess the quality beforehand, if information on quality is easily accessible, and if it's easy to exit, to change a provider. But this is not the case in elder care, because care quality is relational. It is difficult to assess beforehand what actually will happen between two persons, and it is difficult to measure. It's also needed in a very vulnerable and acute situation. It's very hard to be an informed consumer and shop around and find the best nursing home or the best home care provider in a situation when you actually are in need. And according to several studies, older people and their families members find it very difficult to understand the information given, and they found that very similar information is given about all providers. And the consequences of making the wrong decision are serious. Because continuity is so important, you don't want to move once you have moved into a nursing home. So if you move in, you hardly move again, which is again the same problem. I think exit is difficult, and very few people actually change provider. So I would say that there is no reason to expect that choice model would improve quality. So we shouldn't be surprised that it didn't. So finally, is marketization a threat to universalism? Well, I would stress that these large actors that we can see really step forward once you open up for privatization, this is an international trend, they have very strong voices and they can affect public policy. So for instance, they are very much against staffing, minimum staffing ratios. And they can actually lobby quite strongly for that. We had an attempt in Sweden 5 years ago to limit profit making, and they lobbied very, very effectively, very strongly against that. So large actors, strong voices. And also important is that we have seen a change of discourse in Sweden, because elder care users, they are no longer seen as citizens as with rights, but rather than consumers with wants, and thought about and talked about as consumers or customers. Most home care workers in Sweden today talk about their home care users as customers. And also in homes with dementia, we talk about customers with dementia, which is to me a very strange way of talking about in vulnerable situations. Because if you are a customer, you have power, but if you are in need of elder care, you are not really in that type of power. So you need to be treated as a citizen with rights. But of course, there are winners and losers in this kind of situation, because user choice models favors those with more resources, those who can find the best options, and those, of course, who can top up and buy extra services. And here I can see an important risk, particularly with this new trend of own management in residential care, because some of these private companies, not really the big ones, but usually the slightly smaller ones, they build really fancy homes with high rent, and they offer topping up services, which means that they actually actively recruit people who have a good financial situation, and they can make buy extra services. So we will get a dualized system. Do I have another 2 more minutes, I think? Okay, so I think I would just stop with saying a few things about the difference between Finland and Sweden compared to Denmark and Norway. I think it might be of help for the Icelandic situation, because it's about temporality. So why have we seen so much more for-profit in Finland and Sweden than in Denmark and Norway? I would say that legislation matters, because Sweden and Finland over-implemented the EU competition directive, because it would have been possible to protect non-profit care, because it is possible to protect non-profit schools. And Denmark and Norway actually chose to protect non-profit. They can outsource they can outsource a nursing home to the non-profit sector, to a non-profit organization without competition. In Sweden and Finland, it is not possible. So you can have different legislation. There is a scope for that. And today, there are strong demands in Norway for a choice legislation. It might come any day, but we can also see a quite strong trend in Norway to bring back nursing homes to the municipality, and actually also municipalities run by right-wing local government do act in that way. So there are some kind of counter trends there. But legislation matters, I would definitely say. And timing matters, because we had a recession in Finland and Sweden in the early 90s when these ideas came so strongly from England. And the hopes that the competition would save cost made price competition popular among local politicians, while Norway and Denmark, Norway had the oil and Denmark had their economic crisis much earlier. So timing matters probably also. But I would also say that resistance matters, because there is much stronger resistance to marketization in Danish and Norwegian social democracy and unions at the time. Today, it's strong also in Sweden, but it wasn't in the 90s. And Norway has a very strong lobby organization called for Velferdsstaten, for the welfare state. And maybe, but I'm not entirely sure, I think we have very strong interest organizations for private providers in Sweden, and I think also in Finland. And finally, what I definitely think matters is tax evasion. Scandals matter. So we have seen in Sweden some really serious scandals in 2011 with the so-called Carema scandal, showing that we have bonus systems favoring cost saving, but without attempt to protect the quality. We have seen serious tax evasion. We have seen cases of fraud, cases of maltreatment. And that obviously, if media points to those things, we can see changes happening. So for instance, Finland had recently introduced a minimum staffing level because of this kind of scandals in some private nursing homes. So that's where I stop and just end with some suggestions for further reading, and I'm happy to share my slides to anyone who wants them, or you can share them. So, and now I stop share. So, thanks.
Thank you very much, Marta, for a very interesting lecture. To start off the discussions, I would like to maybe move them a little bit closer to home for the rest of us, and ask Drífa and Sonja, what steps have been taken in Iceland down this path that Marta was describing towards marketization of elder care? What is the situation here right now? And maybe to follow up after their answers, to ask you, Marta, are we seeing the same trends here that Sweden saw maybe in the 90s? So if we start with Drífa.
Yes, thank you so much, Marta, for taking the time to share with your knowledge with us. It's really, really important, because I think, as Þórður said, we are in the same situation, I believe, as Sweden was in the 90s or even after the millennium. we have a very strong tradition here for non-profit. And there has been a consensus about non-profit here in Iceland in elderly care and rehabilitation, etc. What you put light on, that there is not a definition or clear path between non-profit and for-profit. It's all put under the same hat as a privatization, and that is very dangerous because we are actually discussing here for-profit and the effect on that. I must say I was living in Sweden when the Carema scandal came to life, and I had the impression that I was moving to the Nordic welfare state in Sweden, and I was very surprised hearing about the large privatization of the elder care and what it meant for workers, for people living in the homes, and of course for taxpayers' money, when we saw actually money going from taxpayers directly through these Carema and to tax havens abroad. And we also know that risk capitalists around the world have increasingly been looking to welfare systems in the Western Hemisphere or Western Europe and the West to increase their wealth. A few points that I want to react on. I think the COVID situation have unveiled that the countries that have strong public systems, they are better equipped to tackle this COVID situation, this pandemic, both because of they have shorter lines to react, as well as they have this social thinking of protecting people and means to do so. What I find very helpful, and my narrative into this discussion, is always is the privatization or profitization, if we say so, in our welfare system, in elderly care and schools, etc. Are they good for the taxpayers? Are they good for the users? Are they good for the employees? And my conclusion is always it's worse for all these three partners. The users, as you so very well put it, go from the thinking of equality, so people are left behind. We see that, as you said, you can buy toppings, so the baseline is you get the bath once a week, but you can buy an extra bath, so you can bathe two times a week. You can maybe, the baseline is worse food, but you can top up with better food, etc. That is the reality we are facing. We are also facing a reality here in Iceland with privatization of the elderly homes in Akureyri, up in the north, which resulted immediately in 10 to 20% reduction of workers' pay. So we are hit very hard now, and we are realizing it very effectively what the effect on the workers or employees. And of course, taxpayers' money, when you have to take a part or share to go into the capitalists' funding. That is, of course, a downside as well. So downside. To take it a little bit further in this discussion, and I have been following a bit the discussion in Sweden about the possibility for privatized companies to react to the pandemic. And I know there has been a huge criticism in Sweden that the understaffing, the low education level of the employees, the workers, etc., and that has made the elder homes vulnerable. You have the same people going from department to department, taking care of people who have the virus and who don't have the virus, etc., because of understaffing. So I know that is a discussion in Sweden and of course a huge research matter in the future. So I would like to discuss that with you, and if we are seeing a little bit of shift in the politics because of the pandemic, because of the result in the privatization, as we see in many Western worlds. I myself feel a little bit of shift in the political debate about this, and I would very much like you to reflect on that in Sweden and the other Nordic countries. Thank you.
Sonja.
Sonja is muted.
Sonja, you're still on mute.
Of course I am, sorry. Thank you, Marta, for your lecture. It's always interesting to hear someone else's kind of discourse in these matters, especially when you can kind of see yourself in it or your country. Like Drífa said, I mean, here in Iceland, there has been a long tradition for non-profit in elder care, but there has been kind of a recent shift, and due to the privatization of the older care home in Akureyri, like she mentioned. But of course, we within the labor union, we share your worries in the matter that you have discussed here today. I mean, the first and foremost is about the equal access, that everyone is given quality service. We recently conducted a study in my federation where we were asking people what their thoughts was on publicly run or privately run in different sections of the healthcare, and one of them was about nursing homes, and the results showed that the majority of the population wants them to be privately run and funded. So it's the same kind of what we think these results show us. There's a kind of a gap between the politicians and the population, like you discussed here earlier. I kind of wanted to take my questions. Let's say that we didn't have to look back, that we were only going to look forwards. And I mean, given your experience and your thorough research on the matter, could you give us some thoughts or insight? I mean, if we just start from square one, we didn't have any structure or any governmental planning on the issue on what kind of services you want to have in elder care. If we would build it from the ground, how would you do it? Also, I wanted to kind of ask you to maybe give us some more insight into the effects on workers within these homes or in elder care. I mean, I think it's a not only an Icelandic question, as you discussed to some extent, that, I mean, they're always trying to cut costs. They're trying to have non-trained people or who do not have the education needed. Here in Iceland, most people are recruited not for fixed term, but for long term. But I mean, there could be an evaluation to the other side. But also just about the working environment. I mean, we see here in Iceland that it has a big effect because people are always trying to cut costs. But also, there's a European study that shows that women in Iceland, now I'm going over to the gender equality issue of it all, is it that they bear the most burden of caring for older relatives and just family, not just the children, but I mean the majority of burden comes from grown-ups in their family. So is there a discussion about this factor if you go over to the workers and maybe the gender equality issue of it all? Thank you.
So, Marta, there's a lot of questions.
Yeah, it's a lot of questions, and my memory is short. I'm old and have short memory, but I start from the back, which is always easiest, start from the end. So, I mean, we have seen it. Marketization is not the only change that has happened in Sweden, for instance. It's also that resources haven't kept pace with the aging population. So we have definitely seen what I call an informalization or refamilization of care. We can see that family has got a families, particularly women, has got an increased role in providing care, particularly because we have closed down nursing homes to a very high extent. Almost 1/3 of the care home places have disappeared since the year 2000, which means that people are cared for at home with home care and care by family, and the home care has become much less flexible, partly because of market privatization, because they have to control the private providers, but they control everyone. So it doesn't work well. But it's not only about marketization, I would say. So there are different changing things happen at the same time. But what would you also asked, well, what would be my suggestion? How would you do it? I mean, I think Norway is an interesting example, which also I think is partly a response to Drífa, you say Dríva? Comment, because they protected the unions were very active there. When these ideas came from also to Norway from England in the early 1990s, they thought we must try to improve elder care in another way. We don't want to follow this route that hope that choice will empower users and then it will improve quality and competition will improve quality, all this kind of rhetoric. So instead they started something called the Model Municipality Project. So they gathered at the local level care workers, retired, the pensioners local organization, family members of people in care home, and local politicians. So they sat down at a very local level and discussed how do we want to improve and develop our local care services. And that was evaluated eventually, and it turned out that in those municipalities where they actually really gave quite a lot of discretion to these local initiatives, that improved quality and made things better. So I think listen to those who are actually living the consequences of changing public policies, as I sometimes call it. Those who live these changed policies, they are the care workers, the residents and care users, their family members, and at the local level. So start at the local level and try to develop the services, because unfortunately, I don't know in Iceland, but in Sweden, the municipalities have not been very good employers. If they would have been fantastic employers and thought about also the care workers as citizens that have to have good situation, I'm not so sure we would have the situation that we have today. But so really think about protecting the system you have and make sure to start local initiative from the bottom and develop services. And I'm sure that will be good things. And also, I mean, you can have a legislation making it less attractive for the market to enter. That is the Norwegian case again. For instance, Attendo has left Norway now because they cannot build their own homes, and they cannot reduce the staffing level to the extent that they want to. So if you have a stricter regulation with minimum staffing ratios, for instance, that could be one way. An American professor, Charlene Harrington, who has done a lot of research in this field, she suggests, first of all, she's extremely surprised about the Nordic countries that the public money that goes into a nursing home, you don't know what happens to the money. There is very little insight in the money, and she finds that totally upsetting. That wouldn't happen in the US, she says, because they have much more information about what happens to the money. So the money can leave. So she suggested, when we had a commission in Sweden looking into how to stop this kind of big profit making, her suggestion was that, first of all, total insight. We have to see exactly at the unit level what happens to the public money. And then her suggestion was that put a piece of legislation that decides that a certain percent of the money that goes into a nursing home has to be paid out as salaries up under the level of the top manager. So for care workers and the first level of supervisors, so for instance, 80% of the public spending has to go to salaries to workers, but that makes it less attractive to cut down on salaries or reduce the staffing, etc. So that would be. And the Swedish Commission didn't follow that advice, but that was her advice of how, if you want to regulate something without having this problem of regulation that makes things, because if you have a very detailed regulation on how to, it can make the work less flexible. We have very bad examples, for instance, from Canada on that aspect. They have hundreds of different rules that each provider has to follow, but it doesn't really impact the quality of services, because each scandal creates a new rule. So it's very detailed regulation, but it doesn't really stop bad homes to survive. So I think that kind of ideas to make sure that follow the money, make sure that you know how money is spent, and regulate so it's not attractive to set up a business there. That could be one way, or following the Norwegian way of okay, if you want an alternative to the public, it can be non-profit. It doesn't have to be for profit. You don't have for-profit schools. So what else should I say? Yeah, about the pandemic. With that, I mean the international. So the international studies they show that it is worse. That it was worse in the for-profit sector in Canada, in the US, where they have in Australia, where they have this kind of data. There were more spread of infection and more death in the for-profit homes because of lower staffing, more people employed by the hour working in different places, and also lower training level. We don't have the information in Sweden. Hopefully we will have some studies done on it, but for the moment we do not know, which is, I think, quite a scandal in itself that that kind of information hasn't been collected by the authorities. But hopefully it is possible to investigate, but for the moment we do not know. We had a very recent and ongoing media scandal right now with one of the biggest, or actually the big company, Attendo, because they have been given quite a lot of money because of the loss of income during the pandemic, and they have paid out bonuses for their managers, and they just the day before yesterday they stopped this bonus system. But they have also a scandal in that sense that they have hidden information to family members, and one care worker went to media and they threatened her that she wasn't allowed to inform media about this, that they were hiding information to families about the actual situation in the home. But they are saying that this was this. So now they're saying that this was totally wrong and it shouldn't happen. And she has been kind of recognized now. But that happened only after the radio sent a documentary on this. So we have media attention is important because of course these companies are very sensitive to that kind of bad will, of course. Have I forgotten something? I'm sure I have. One point.
Okay.
I mean, sorry, I have an Australian colleague, Gabrielle Mayer, and she says she usually distinguishes between for-profit and non-profit. There are two entities. And under non-profit, she puts private and public. Can you see the point? So the distinction is for-profit or non-profit. We have a traditional distinguishing between public and private. But they have a tradition of distinguishing between for-profit and non-profit, and non-profit can be either public or private. That's a very different way of thinking, which I think it's not a bad idea, because we have this kind of public and alternative, it was even called.
Iceland has, as things stand in all comparison, a very young population. That will change drastically in the next few decades here. And the first large steps will be taken with a large group of baby boomers approaching the end of their working life in the next few years. the number of people that will need elder care will thus increase drastically in few decades. I was very. You mentioned in your lecture that voters of parties in Sweden are more against the marketization or privatization of elder care services than the MPs of those parties. In Iceland, we have maybe 2 political parties that have a policy of privatization or marketization in healthcare as a general policy, and they are polling around maybe 35%. Sonja mentioned earlier that a recent study that was conducted by her organization showed that almost 60% of the general public was against basically marketization of elder care, and only 3.3% were of the opinion that only private entities should run elder care institutions. So my question is, in light of all these facts and in light of what is coming here in Iceland, because we have this need for vast growth in this area and this spectrum, what powers are there that are driving this greater push for marketization? What are the actors at play here? Because it's not the general public. What are the powers that we then need to look out for, and the signals that we need to look out for if we want to learn from the mistakes that were done in the other Nordic countries? Yeah,
good question. I would say. I mean, I haven't. I think no one can argue that this has been driven by the pensioners' organizations. It hasn't been. We have strong pensioners' organizations in Sweden. They have not been arguing for more private market. Definitely not. We have one more social democratic oriented and one more right wing party oriented. But none of them have actually been driving this issue. I would say it has been driven by. Mainly by the private market, by the market who see a possibility to make money, because it's a well-funded sector and it is a safe sector, because and particularly in aging population, we know that there will be a need of services. And I also think that the Nordic countries have been attractive because we have not a history of for-profit providers, and therefore we had very little regulation. It was a very unregulated sector in Sweden, at least in the 90s. So it was very easy for companies to have their mother companies in tax havens and bring out quite large amounts of money out of the country through certain loans that they had paid back with very high interest rate, etc. It is probably a bit more regulated now, but it's hard to know because they have a very complicated industrial structure. So I think it is been driven mainly by those who can make money out of it, but also by some parties, and of course also the employers organizations, the private employers organization are also lobbying quite strongly for to their parliamentarians. But mainly I think it is an economic interest. I don't think in any country it has been driven by older people themselves. It's a bit different with the disability services like personal assistance, because that has been partly been driven by people with disabilities themselves. But in no country I have seen it has been driven by older people themselves or their organizations.
Very shortly, both Drífa and Sonja, maybe Sonja gets to start this time because we're running out of time. What has been your experience? What are the powers at play here that are driving for more marketization or privatization for these elder care institutions and especially going forward?
I mean, the discussion is at another place than it is in Sweden. I mean, we have to state that fact to begin with. But other than that, I completely concur with Marta. I mean, I feel that, and I actually wrote an article recently on the matter that, I mean, the political slogans that were born 40 years ago from Reagan and Thatcher, they're kind of still driving the forces here. And I think they're both old, and also that you have to give more attention or just listen to people who have researched this matter. And that's why I think your lecture today was really important towards taking the discussion further and not only by a single story or political slogans. So just thank you again if I don't have the opportunity to thank you.
Drífa.
Yes, thank you. I think we are seeing the same trends here in Iceland as all over the place. That is to starve services into privatization. And the municipalities here in Iceland are small, many of them. The elderly homes have been a huge burden on them. So we haven't had this government-funded guarantee for the elderly homes. So politicians go into the simplest solution possible and push away the responsibility for it. And that is what's happening here. So we see the same trends as every trend in privatization everywhere. You make the service worse, you make the conditions worse, and then of course you have the consumers even or people, public people trying to taking care of their elderlies to push forward on privatization. But it is a political issue. It is maybe the core of the political issue, whether we look at people as consumers with wants or what do you say, citizens with rights. Yeah, yeah, and I think that's such a brilliant phrase. And that is, of course, the political polarization that we are seeing. But we are well equipped now, or better equipped, for the discussion here in Iceland after your lecture. So thank you very much.
And that needs to be the last words. We've run out of time. I would like to thank Marta Szebehely, especially for her input and her lecture, and the other panelists and all participants that watched today. Thank you.
Thank you.